Question 1. A nurse is caring for 4 clients. Which one should be assessed first? A. A post-op client requesting pain medication. B. A client with a blood glucose of 68 milligrams per deciliter. C. A client waiting for discharge teaching. D. A client needing assistance to the restroom. Answer. B. A client with a blood glucose of 68 milligrams per deciliter. Question 2. Which task is appropriate for the RN to delegate to the UAP? A. Administering a tube feeding. B. Evaluating a client's pain level. C. Assisting a client with morning hygiene. D. Educating a client about wound care. Answer. C. Assisting a client with morning hygiene. Question 3. A client is found unresponsive. What is the nurse's priority action? A. Notify the provider. B. Call the family. C. Check for a pulse. D. Document the finding. Answer. C. Check for a pulse. Question 4. Which of the following must the RN complete and not delegate? A. Bathing a stable patient. B. Ambulating a post-op patient. C. Evaluating response to pain medication. D. Feeding a client with dementia. Answer. C. Evaluating response to pain medication. Question 5. A nurse assigns a stable client to an LPN. What is the best indicator that this task is appropriate? A. The LPN states they are too busy. B. The LPN has cared for the client before. C. The client requests only RNs. D. The task requires complex decision-making. Answer. B. The LPN has cared for the client before. Question 6. Which patient should the nurse assess first at the start of the shift? A. A patient scheduled for discharge. B. A patient reporting new shortness of breath. C. A patient requesting a dressing change. D. A patient due for a routine blood draw. Answer. B. A patient reporting new shortness of breath. Question 7. The RN assigns a new diabetic patient to the LPN. What must the RN do? A. Nothing. The LPN can manage independently. B. Perform the initial assessment. C. Administer insulin. D. Teach insulin injection techniques. Answer. B. Perform the initial assessment. Question 8. Which situation requires immediate intervention to prevent harm? A. A patient drinking fluids before surgery. B. A patient refusing to take vitamins. C. A patient requesting more pillows. D. A patient awaiting discharge instructions. Answer. A. A patient drinking fluids before surgery. Question 9. What action should the nurse take first when a client develops sudden confusion? A. Administer sedatives. B. Restrain the client. C. Assess oxygen saturation and vital signs. D. Call the family for baseline behavior. Answer. C. Assess oxygen saturation and vital signs. Question 10. Which client can be safely assigned to an experienced LPN? A. A client with unstable vital signs. B. A client newly diagnosed with sepsis. C. A client requiring routine wound care. D. A client requiring 4-push medications. Answer. C. A client requiring routine wound care. Question 11. A nurse delegates vital signs to a UAP. What is the RN's responsibility? A. Document findings without review. B. Validate and interpret the results. C. Teach the UAP how to take blood pressure. D. Ask another RN to confirm readings. Answer. B. Validate and interpret the results. Question 12. Which task should the RN perform rather than delegate to an LPN? A. Obtaining a sterile urine specimen. B. Administering a tetanus booster. C. Teaching insulin administration. D. Monitoring INO for a stable client. Answer. C. Teaching insulin administration. Question 13. A nurse walks into a patient's room and finds them gasping and cyanotic. What should the nurse do first? A. Call a code blue. B. Start CPR immediately. C. Take a set of vital signs. D. Check for a DNR order. Answer. D. Check for a DNR order. Question 14. Which of these patients is a priority for immediate assessment? A. A patient with a chronic headache. B. A patient with a potassium level of 6.2 milliequivalent/L. C. A patient requesting a snack. D. A patient scheduled for physical therapy. Answer. B. A patient with a potassium level of 6.2 milliequivalent/L. Question 15. What is the nurse's best response when a UAP refuses to take vitals for a client with COVID-19? A. Reassign the task without further discussion. B. Take disciplinary action. C. Clarify infection control procedures and provide support. D. Document noncompliance and ignore it. Answer. C. Clarify infection control procedures and provide support. Question 16. Which client should the RN see first after receiving shift report? A. A client requesting information about a new diet. B. A client newly admitted with chest pain. C. A client requesting a sleeping pill. D. A client needing a wound dressing change. Answer. B. A client newly admitted with chest pain. Question 17. A nurse is preparing to delegate ambulation of a client to a UAP. Which information must be provided? A. The client's discharge plan. B. Whether the client prefers walking. C. Specific instructions and fall precautions. D. A review of the client's full medical history. Answer. C. Specific instructions and fall precautions. Question 18. Which action should the nurse take first if a patient has a blood pressure of 80/40 mmHg? A. Notify the physician. B. Recheck the blood pressure manually. C. Ask the UAP to monitor it. D. Administer 4 fluids. Answer. B. Recheck the blood pressure manually. Question 19. An LPN reports a patient's worsening condition. What is the RN's next step? A. Thank the LPN and document the report. B. Ask the UAP to recheck vital signs. C. Assess the patient immediately. D. Call the healthcare provider based on the LPN's report. Answer. C. Assess the patient immediately. Question 20. Which task is safest for a UAP to perform? A. Applying a sterile dressing. B. Teaching a patient to use a walker. C. Assisting with ambulation post-surgery. D. Adjusting oxygen flow rate. Answer. C. Assisting with ambulation post-surgery. Question 21. A nurse is caring for a client with a history of placenta previa. Which action is a priority? A. Monitor for signs of infection. B. Assess for painless vaginal bleeding. C. Palpate the uterus for contractions. D. Encourage early ambulation. Answer. B. Assess for painless vaginal bleeding. Question 22. Which task should the nurse assign to the LPN on the labor unit? A. Interpret fetal heart monitor strips. B. Monitor for oxytocin infusion during induction. C. Administer oral pain medications to a stable client. D. Develop a care plan for a high-risk pregnancy. Answer. C. Administer oral pain medications to a stable client. Question 23. A nurse notes a boggy uterus in a postpartum client. What is the first nursing action? A. Notify the healthcare provider. B. Start a second 4-line. C. Massage the fundus firmly. D. Insert a Foley catheter. Answer. C. Massage the fundus firmly. Question 24. A nurse observes variable decelerations on the fetal monitor. What is the priority action? A. Administer oxygen via face mask. B. Reposition the client. C. Discontinue oxytocin. D. Prepare for cesarean delivery. Answer. B. Reposition the client. Question 25. The nurse is planning care for a client with severe preeclampsia. Which task should be delegated to a UAP? A. Monitor deep tendon reflexes. B. Measure urine protein level. C. Assist with hygiene needs. D. Assess for visual disturbances. Answer. C. Assist with hygiene needs. Question 26. A client is in the third stage of labor. Which assessment is most critical at this time? A. Maternal temperature. B. Fetal heart rate. C. Fundal firmness and bleeding. D. Bladder fullness. Answer. C. Fundal firmness and bleeding. Question 27. A nurse is caring for a client receiving magnesium sulfate. Which finding requires immediate intervention? A. Absent deep tendon reflexes. B. Fetal heart rate of 140 bpm. C. Mild nausea. D. Urine output of 40 milliliters per hour. Answer. A. Absent deep tendon reflexes. Question 28. Which statement by a pregnant client requires further education? A. I will lie on my left side to improve circulation. B. I will take my prenatal vitamins daily. C. I will avoid lunch, meats unless heated. D. I can continue taking ibuprofen for headaches. Answer. D. I can continue taking ibuprofen for headaches. Question 29. A laboring client suddenly complains of chest pain and shortness of breath. What is the priority nursing action? A. Apply oxygen and call the provider. B. Check the cervix for dilation. C. Prepare for epidural anesthesia. D. Place the client in Trendelenburg position. Answer. A. Apply oxygen and call the provider. Question 30. A nurse is preparing to assign tasks. Which client should the RN care for directly? A. Stable client 2 hours post-vaginal delivery. B. Client with suspected uterine rupture. C. Client needing perineal care. D. Client ready for newborn discharge teaching. Answer. B. Client with suspected uterine rupture. Question 31. A nurse is caring for a pregnant adolescent. Which action demonstrates advocacy? A. Teach about safe sex practices. B. Offer prenatal vitamins. C. Provide privacy and involve the client in decisions. D. Discuss pregnancy outcomes with parents only. Answer. C. Provide privacy and involve the client in decisions. Question 32. What is the priority nursing action during a postpartum hemorrhage? A. Call the rapid response team. B. Administer pain medication. C. Assess uterine tone and massage if needed. D. Insert an indwelling catheter. Answer. C. Assess uterine tone and massage if needed. Question 33. A newborn is placed under a radiant warmer. What assessment is most important? A. Skin turgor. B. Axillary temperature. C. Respiratory rate. D. APGAR score. Answer. B. Axillary temperature. Question 34. A postpartum client expresses fear about caring for her newborn. What is the nurse's best response? A. Don't worry, it gets easier. B. You just need practice. C. Let's talk about what you're feeling and how we can help. D. Your partner can help too. Answer. C. Let's talk about what you're feeling and how we can help. Question 35. A nurse is assessing a pregnant client with gestational diabetes. Which finding is concerning? A. Blood glucose of 88 milligrams per deciliter. B. Fundal height appropriate for gestation. C. Headache and visual changes. D. Mild lower back pain. Answer: C. Headache and visual changes. Question 36. A nurse floats to the maternity unit. Which assignment is most appropriate? A. Unstable preeclampsia client on magnesium sulfate. B. Laboring client with fetal distress. C. Postpartum client needing discharge teaching. D. Client with shoulder dystocia during delivery. Answer: C. Postpartum client needing discharge teaching. Question 37. A nurse is caring for a postpartum client with a history of bipolar disorder. What is most important? A. Provide dietary counseling. B. Monitor for signs of postpartum psychosis. C. Educate about newborn immunizations. D. Discuss breastfeeding positions. Answer: B. Monitor for signs of postpartum psychosis. Question 38. A nurse is teaching a prenatal class. Which topic has the highest priority for third trimester clients? A. Bottle feeding techniques. B. When to go to the hospital for labor. C. Diapering and bathing the baby. D. Postpartum exercise routines. Answer: B. When to go to the hospital for labor. Question 39. Which action by the nurse promotes newborn safety immediately after delivery? A. Administering vitamin K. B. Placing the newborn on the mother's abdomen. C. Suctioning the nose and mouth. D. Placing an ID band on the infant. Answer: D. Placing an ID band on the infant. Question 40. A nurse notes bright red bleeding in a client 24 hours postpartum with a firm fundus. What is the likely cause? A. Uterine atony. B. Perineal laceration. C. Retained placenta. D. Endometritis. Answer: B. Perineal laceration. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.